you finished your chemotherapy. Now there is a lot of residual chemo or cells which stay in the intestine or stay in your body. You need to get rid of it, because it can, if there is only even possibility of one single cell, a minute cell which is still alive, or cancer cells, right? It can trigger. Anything can trigger. So you need to keep that in mind. Every day, the immune system fights with the cancer cells. So we need to keep our immunity at very high, like, lymphatic system very good. Also keep your lungs and your liver and the kidney health very good. So these are the few things which, very simple things: move, breathe, eat properly, and also have a good connection with your heart and soul. Very, very important.
Good day, everyone. Welcome to the VoCP Talks, a platform to empower the cancer community. Our guest speaker today is Shruti Sethi. Shruti is a Cornell-certified plant-based nutritionist and a holistic cancer coach. She graduated from the Institute for Integrative Nutrition and is an expert in Yoga Therapy and Ayurveda. Prior to 2016, she was a very successful fashion designer, and she changed her career path after she was diagnosed with Hodgkin lymphoma. And in 2021, she founded Awaana Health, which is a holistic healthcare center, and it aims to address the root causes of chronic diseases instead of just suppressing the symptoms. Thank you so much for joining us on today's session, Shruti. Shall we get started?
Absolutely.
Could you tell us about your journey to the founding of Awaana Health? What were the motivating factors behind this decision?
As you were just mentioning about my journey and cancer, I was diagnosed in 2016 with Hodgkin's lymphoma. And that was the starting point. The whole journey, basically, I documented my whole journey. And there were a lot of pain points when I was going through the journey, about the diagnosis, about the kind of nutrition one needs to have, about the kind of lifestyle changes, about, what to do after cancer, not to have cancer back. So there were many, many questions which I got the answers, and it took a lot of time for me to gather these answers, going to various experts, talking to various doctors. And at that time, somehow, of course, I had no idea about being a health coach, about being a cancer coach, or about nutrition, etc. I just thought that, God, or if there is any higher power, if you're listening, please, if I get better, I'm going to do something about it. And that seed of this entire journey, that this passion was, that time it was planted in my head. And slowly and gradually, when I started sharing my journey with others, and when I became a health coach, and when I started talking about my journeys, a lot of cancer patients were coming to me for consultations. So I thought that why don't I make this a formal platform where people get these answers, where there is complete resolution. There is a 360-degree approach. There are doctors, there are nutritionists, there are naturopaths, there are healers, there are yoga therapists. So I wanted to present people with the entire solution, where you come and you get all the experts. You don't have to go anywhere. There are many, many questions around cancer one needs to really figure out. So this is something which really motivated me to start Awaana Health. And we work with a lot of cancer patients. We do nutrition for cancer. We tell them how to exercise, what to eat, what not to eat. There are different therapies. So we give, and it's an absolutely online platform. So people all around the world can join in. And it's very, very, I must say, we've gotten very good results with our clients, and it's quite satisfying to help someone.
So you were diagnosed with stage 3 cancer back in 2016. And how did it affect you mentally and physically?
Any diagnosis of cancer is not easy. Of course, it hit me like a bullet train, and it was difficult. It was not acceptable at all. Like for me, it was not acceptable. How can it happen to me at such a young age? I was 34, and it was mentally like very, very challenging to accept it. It was. It was just like, no, it's not happening. It's just a dream. It's not happening. There, when you hear the word cancer, it's so frightening. It's like, oh my God, there are hundred of questions going on. Will I lose my hair? What kind of treatment? Am I going to get a secondary cancer? Am I going to survive it? Because whatever stage it is cancer.
Terrifying.
It's scary. It's scary. So I was scared. I was confused. I had anxiety. I had a lot of other questions that every cancer patients go through. So it was not an easy thing to know. I mean, physically, I was very fatigued at that time when the diagnosis happened. My body was like absolutely bloated. I had no energy. Mentally, I was down, absolutely down. I really didn't want to fight it. Like, I just wanted to give up. But slowly and gradually, I guess, I got this strength.
Yes. So let's come to what you do now. And so, what are some of the biggest risk factors of cancer?
Number one, the 70% of the cancers, and it's proven, right? Like, it's proven 70% of the cancers happen because of your incorrect lifestyle. Now, when I talk about lifestyle, it's of course the way you eat, what you're eating, and how is your body taking. Like most of the people I feel are eating certain kinds of food, and it suits their body or it doesn't suit their body. For example, me, I was always a vegetarian. So being a vegetarian, I had that I am always going to live healthy. But that was not the case. Certain things were not suiting me since childhood. Say for example, dairy. I was dairy intolerant. But my body was, giving always the signs and symptoms, but we don't understand it. So, if you are eating certain kinds of food and which is really not going with your body, you have to understand, you have to make this relationship with your body. So it's important for, I mean, whether it's non-vegetarian, whether it's vegetarian, whether it's vegan, whether it's whatever diet you're following. The question is not that it's good or not. It is what the question is whether it's good for your body. It's an individual question. So I had to really understand aspects of nutrition, aspects of different sort of thing, about how my body was reacting with certain things. So food, by nutrition, I mean that what are the foods which is suiting you, which is not suiting you. You need to eliminate those. Uh, it plays a very important role of one getting cancer, nutrition. Because we are eating a lot of toxic food around us. There is toxicity in our water. There is toxicity in the crop. There is toxicity in the grains. Everything in the vegetables, in the non-vegetarian protein, and in whatever protein you're taking. So we need to be mindful of it. What is the source of your food? Where is it coming from? Right? Even picking up certain vegetables, right? If you are picking vegetables, for example, which is like overgrown and very pretty looking, that means definitely there is some injection going in. The bananas are like ripe and really nice. That's like absolutely infested with injections. So you need to be very mindful, and especially today's age, and where you do not, the fruits and vegetables your food is coming from overseas, where it's not even raised or even grown in your own country. So what are the repercussions? If you're eating, say for example, an apple which is grown in New Zealand, and it is like completely stored in the refrigerators and and you're eating those, what is the shelf life of that apple? Or if you're eating an apple which is completely
Yeah,
waxed, right? Like to shine it and to make it
appealing.
make it
Yeah.
very attractive to the customer and appealing. But is it really the thing which you need to eat? You're eating plastic basically, right? We are consuming so many plastic foods. There's so much plastic around us. So the lifestyle I meant is not only nutrition, but it also is like, where is the food coming from? What is the source of food? How are you storing your food? What kind of water are you consuming? And how are you taking in the nutrition? How are you detoxing your body? It's so important, right? It's so important, assimilation, and also detoxing the kind of food you're eating. Because we also have to understand that there are toxins in the environment. Every day we are surrounded by a lot of free radicals. Now these free radicals, of course, can disturb your gene coding. It can do a lot of cellular damage. When the cellular damage happens, then of course it affects the immunity, and then the genes starts to basically reverse, and the gene starts to basically again you know multiply. There can be some coding gone wrong, and then that's the start of the gene getting multiply, and then it can convert into cancer. So what are the foods? What How are you surrounded by? Like, a lot of people are surrounded by a lot of radiation, right? Radiation can also affect us to a larger extent. So, by lifestyle, food, nutrition, how you think, are you really stressed out? Stress can trigger cancer cells. Uh, if you're not moving around, like if you're not exercising every day, that means something's really gone wrong. We are not meant to sit at one place. We are meant to move. We have to take sunlight. If you're not taking enough sunlight, right, we need to go out in the sun and be in nature. A lot of people are nutrient deficients, and people just take multivitamins day in and out. But is that really getting absorbed in your body? I don't think so. So these are the kind of things, the lifestyle which I thought, oh my God, I am doing absolutely well, but it was such a shocker when all these things happened, and it was like, oof, I never looked into this. I never went out and saw the sun. My vitamin D levels were absolutely low. So it is a multifactorial. All of these combining, you cannot pinpoint only one factor, but it is a factorial thing. Everything combining, I think, can cause cancer. Also, one thing which I really want to tell is, people who smoke up or smoke or drink, that's a form of lifestyle. So, drinking a lot is also very harmful. It does a lot of cellular damage no matter what. If you are smoking every day, it will definitely affect your lungs, your tissues, your organs to a larger extent. I mean, the damage is every day. So be mindful of your choices, because it can result into something very drastic.
Considering all these issues that could lead to cancer, we can't pinpoint exactly what could lead to cancer, but what are some of the best practices that a person can adopt into their lifestyle to prevent cancer or recurrence to an extent? Like, we can't say if you do this, you will stop cancer, but to an extent.
No. But what I feel is that there are certain things which everybody should do on a daily basis, which can prevent. Now, what are these few things? Number one is movement, right? Any form of exercise where you sweat it out, right? You're sweating out because you just need to remove these toxins which you accumulate from on your skin or from different things. You need to move. Movement is important because you need to. It's also because when you move, the muscles and your organs, they kind of get twisted, and from there also a lot of toxins come out, and it just comes out in the form of sweat. Number two is of course, look into what you're eating. Very, very important. Have more fiber in your diet. Have more antioxidants in your diet. Have phytonutrients. Even if you're taking animal protein, make sure you combine it with certain right fiber and certain right greens. That's very important. Number 3 is, of course, doing mindfulness exercises, taking care of your stress and mental health. It's so, so important. Everybody knows that mental health, during COVID, we all knew that mental health has become such a big issue. Talk to someone. If you're really down, don't hide your feelings. You should not suppress the emotions. Go and talk to a therapist. Go and talk to someone who you really trust. But don't keep these emotions hidden in you. Number 4 is, I think what we also need to do is keep detoxing our body. There are different therapies through fasting. Fasting is a beautiful protocol. It's inexpensive. It starts with intermittent to water fasting to say juice fasting or any other form of fasting is important. Yes. What happens with fasting is there's something called autophagy which happens, which with the new neurons get developed and the old cellular cells which are there. This is very important for anybody who has gone through cancer. Say, for example, you finished your chemotherapy. Now there is a lot of residual chemo or cells which stay in the intestine or stay in your body. You need to get rid of it because it can, if there is only even possibility of one single cell, a minute cell which is still alive or cancer cells, right? It can trigger. Anything can trigger. So you need to keep that in mind. We have every day our body produces cancer cells. Every day the immune system fights with the cancer cells. So we need to keep our immunity at very high, like lymphatic system very good. Also keep your lungs and your liver and the kidney health very good. So these are the few things which very simple things: move, breathe, eat properly, and also have a good connection with your heart and soul. Very, very important.
So, what are some of the benefits that alternative medicines offer compared to traditional medicines that most people go after?
Yeah, see, there are first of all, what are these alternative medicines? There can be a lot of other alternative medicines, like for example, there is vitamin C IV therapy, there is oxygen therapy, there are a lot of nutritional therapy which are there. Now, if they are like these complementary therapy, I'm not saying no to the chemotherapy or no to the conventional therapy, but the point is that all these conventional therapies have immense amount of side effects. How do you counter the side effects? Is through these alternative therapies. So even if you're taking these therapies, I would strongly suggest go with the alternative therapy approach as well. Combine the both together, complement the therapies, have this alternative part and the conventional part merged together and go with the middle part. Because you need science and you need the other side of the science as well. There are a lot of evidence proof that now that these alternative therapies do help. And of course, it doesn't come with the side effects. But sometimes when it is also the question of your mind. If your mind is really strong, and what kind of cancer it is, what type of cancer, what stage it is. If you think that conventional therapy is important for you to take, do not ignore the alternative healings and the path as well, because they kind of complement and the resolution is much more better. If you take a part of conventional therapy and you are taking, say for example, a nutritional therapy along with it, if you're taking acupuncture or if you're taking IV therapies, the results are much more better. That you will not go through side effects, you will not go through immense amount of pain. See, it's also a matter of somebody's mind. If your mind is really strong and your heart says that you do want to try the absolute alternative path, then you should find an expert, because there are hundreds and hundreds of alternative therapies. But what is not really right is the structural part. Now, every type of cancer needs a different sort of a therapy. What you need to find is like an expert where you can go to, and where the doctor also approves of certain things. And if you go with that path, say for example, if I would not suggest for a 70-year-old or after a 60-year-old going with chemotherapy, because the body cannot take the chemotherapy, right? And if you're not doing your nutritional therapy, you're not eating properly, your body would not able not be able to take it. So there are alternative approaches, but you need to figure out and find out the best possible expert for it and go under their guidance. Just don't Google things and do it yourself.
Some family members and friends find it hard to are unsure on how to talk to people with cancer. And this leads to different strains in these relationships and makes it even tougher for these cancer patients. So, what would your advice be to these family members and friends?
It is tough. See, the thing is that what happens with the cancer patient, and I'm talking about my experience, is we do not want sympathy, right? Any cancer patient already is like, oh my God, hospital and this and that and this therapy. Somebody talking, oh, it's okay, whatever happens, you'll go through it and everything. We just don't want to hear the word because we're already trying our best, right? I'm talking from the perspective of a cancer patient. It's really difficult to go through the hospitals and talk to the doctors and understanding the prognosis and the diagnosis and all that. And if somebody is there and if somebody is overly getting sympathized or overly giving you sympathies, you feel you don't want it. You just don't want it. You will deal with it. Now, there is a very, very thin line where the caretakers or the friends and family can come in. It's just to be there and support them in whatever it is. Whatever is going in their mind, they need to give space. They need to understand that this person is going through something which is very hard to accept. What can you do is just give that person enough freedom and space to talk it out, right? To talk what is going on in their mind without any judgments or without anything. Once that space and that barriers is over and it's like they kind of open up, they will also open up what are the fears, what are the challenges, because you go through certain pains and all that only cancer patients do. The other people don't even know it. So you need to give them space, understand, talk to them in a way which is a normal person would do. And then slowly when they open up in you kind of say, okay, if they say that, I'm in pain and I just can't handle this, then you kind of come in as a caring parent or a caring caretaker. If let's find the best possible solution for this. Let me just do some massage, or let me just give you something and all. So that is the way you talk to them. You don't over sympathize, but just also give them space and just let them talk to you. And sometimes the cancer patients become very quiet, right? Like they're absolutely quiet. They don't want to talk about anything else. That is the space where you really don't want them to be in, because they are really not. They are keeping everything inside. So now, as a caretaker and as a parent, you need to come in and you need to sit down and tell them that, listen, I know you're going through something. We are there for you in every step of the way. Let's fight it out. Let's see what we can do the best. And tell us what you're facing. Maybe if you are not comfortable to talk to us, let us get a cancer therapist, let us get a psychologist where you can talk to and you can open about it. So these are some techniques which really a caretaker and a parent should apply when talking to a cancer patient. I mean, see, no matter what, the cancer patient want the attention. They want people to be around them. They want the love and care because already they've gone through. But you need to figure out how to really give that love and care and in what form.
So rather than just sympathizing, you need to give them the space for them to express their emotions and tell you what they feel and what they need.
Absolutely. Absolutely, and empathize with them.
So, to the next topic, you are a plant-based nutritionist, and you said you have been a vegetarian all your life. All your life, yeah. Okay, so what are some
Yes,
of the benefits
yes.
that plant-based diet hold over a diet that consists of both animal-based and plant-based products?
See, yeah. So main thing, even I was a vegetarian, I used to feel like a lot sick as a child. I had immense amount of problems with my bloating, constipation, acne. Oh my God, hormonal issues. I kind of had PCOD, PCOS, which I found out later. And the main cause was consumption of dairy, which was really not like, for coming from a vegetarian background, it was absolutely, no, how can I not take dairy? How can I not take milk, calcium, and protein? I only know one source of this. But the moment I actually turned plant based, I found an immense difference in my energy levels, in my skin, in my digestion, in my overall mental health, not only physical but mental health, and the kind of, I think I'm more healthier than ever. So there are immense benefits. Number one, you take care, you eat, when you eat the kind of food which comes from nature, and your body digests it so beautifully. Like, the fiber, the greens, the fruits and vegetables, you will find that you're feeling lighter. But when you, it's also sattvic food. It's the energy, right? The energy of plant-based food is much more higher than the energy of, say, animal protein in terms of the consciousness. So I'm talking from a very, very different energy point of view, or consciousness point of view. And what difference I found when I turned the plant-based when I inculcated plant-based eating in my lifestyle. So my consciousness went higher.
We often hear that a vegan diet will not give us all the nutrients that are necessary for a regular individual. So, if this is true, there
Right.
must be ways to combat these deficiencies. Could you tell us a few of them?
See, I think any diet you take paleo, you take keto, you take a non-vegetarian diet, you take vegetarian diet or a vegan diet. It's the kind of food. What kind of food are you taking, and with what awareness? Even if you're taking non-vegetarian food, there will be certain deficiencies. Even if you're taking vegetarian food, there will be certain deficiencies. Keto, paleo. So vegan food, I think it's just because people have just over analyzed it. Of course, you need B12, and you need to eat a proper good amount of protein and all, but that's the case with every other diet, right? It's the case with every other diet. If you are careful on what you are consuming and how are you consuming, I don't think so any form of diet will go wrong. And how is your body adopting? When you talk about a vegan diet, now in a vegan diet, I'm telling you, people go vegan, right? People just go vegan and they eat, like, say, for example, banana chips or processed food, or they drink Coca-Cola. Coca-Cola is vegan, eating a lot of sugar is vegan. That's not the point. The point is going completely plant based, which is like coming from the source. So you need to give up processed food. You need to give up sugar. You need to give up food coming from plastic, food coming from the packaged foods. That is something which people don't do, and they just don't vegan for the sake of it. And they'll have certain deficiencies because they're not eating proper fiber, they're not taking proper food, they're not having a lot of good nutrient dense food. So B12 deficiencies, yes, you get while you're having
Vegan diet.
on a vegan diet, but that is the case right now with vegetarian and non-vegetarian foods. B12 is made in soil, right? It's made in soil. So you, of course, you have to take a supplement for it. Vitamin D, which everybody is deficient on, whether you're a vegetarian or a vegan, it just comes from the sunlight, right? And your basically it's also a lot of to do with your vitamin K levels, and if your vitamin K levels are not good, and your so you will not even absorb proper vitamin D as well.
So earlier you said that when you start with plant-based diet, you were more conscious, you were more energetic. So how exactly does a vegan diet help your mental health?
I think again the plant-based diet, what it does is, first of all, if you see the statistics of a lot of mental health cases, most of them are nutrient deficient. Most of them have nutrition deficiency, and when you really take care of the nutrition deficiency, even your mental health gets proper. I remember a case in Jaipur. I was dealing with this very young boy, and he was suicidal. So we did his blood test. We did his blood work, and all it came that he was nutrition deficient from vitamin D and B12. Now, when you talk about plant-based food, now plant-based foods, of course, have a lot of phytonutrients. They have a lot of they they have a lot of antioxidants in their diet. In when you eat plants, when you eat foods which can get digested well, it definitely goes with properly with your gut. You eat a lot of probiotics and prebiotics. Your gut health also improves. Your gut and your mind is definitely connected. So when this connection is strong, when this connection is good, so all you need to do is, whenever you have anxiety and all, look into your daily routine. What are you consuming? If you're doing a lot of caffeine, right? If you're doing a lot of other form of alcohol, maybe, if you're taking wrong kind of food, first change that, and then you will see a drastic difference.
Do you have any tips for cancer patients on how they can improve the diet so that they can have an easier recovery?
So, whenever somebody gets a diagnosis, first of all, understanding the root cause, of the cancer, going a little back into your childhood, going back into 3 or 4 years before, as to what is the body telling you, what kind of symptoms did you have. I was just talking to someone yesterday, and they said that they always had constipation, but they ignored it, and then they got colon cancer. So this is the body's talk, right? The body talks to you. The constipation was there prevalent, but in some, you feel that it's a simple thing. It's everybody goes through it, but it can lead to something called something drastic like cancer. So one needs to be very mindful of what the body is talking and what how the body is behaving. Our body needs to be functioning in an optimal level every day. If it's not working optimally, that means something is really wrong. Either in your lifestyle, either there are nutrition deficiencies, or there is something else going on. So, so look into it. Your body organs every day. Our body detoxes and all. We need to really sit down and understand where did the root cause come from, and one of the root causes, of course, is lifestyle. So how do you change when you're how to the 3 or 4 simple things which you need to do is just avoid sugar. Absolutely no sugar in your diet. For cancer patients, I'm talking about. Even if it's jaggery or honey, just simple sugars which are easily digestible. You need to just have dates and raisins as a sweetener. You can like use date sweetener or date syrup as a sweetener in your food. Number two is get rid of dairy, like because dairy creates inflammation. The other thing which you can do is also understanding that what is the protein, like stop any animal products, because for a simple logical reason that it overloads the digestive stress. The keep it very simple, light, so that you also need to fight the cancer at the same time. What is a cancer fighting foods? These are these beautiful herbs, fruits, vegetables, and all these like phytonutrients and stuff, which you get with all those spices and all. So you need to greens and beans and mushrooms and all that. So there's 4 or 5 things if you can put into your practice as a cancer patient. I think you will find tremendous good results.
You are a yoga expert as well, apart from the nutritionist. And what are some of the benefits that yoga and meditation have on cancer patients' health?
There are immense benefits of yoga and meditation. Like, I can't even tell you. So, in my journey, I started yoga while going through cancer, and I was on and off before, but really started doing yoga while I was going through. So, first of all, it improves the energy levels. You do certain pranayams and you do certain asanas. Not like a lot of hardcore asanas, but very simple asanas. Just do subtle stretches and everything, which improves the flexibility. When you hold the asanas, the kind of balancing asanas and all, it also balances your mind. So yoga is basically the way of life. It's also the connection which is there. It's just not looking good or doing having a lot of flexibility. It's also creating a balance between the mind and body. So when you do these asanas, when you do pranayams, when you do holding asanas, when you do these balancing poses, it has a tremendous benefits on your mind as well. We need a lot of oxygen, right? As when you're going with cancer, the cancer cells do not live in a oxygenated environment. There are two reasons primarily why the cancer happens: is the body going acidic, like to the cellular level, and the oxygen going less to the cellular level. So when you have a lot of oxygen in your body, the cancer cells also die. When your body is alkaline, the cancer cells also die. So you need to understand that you need a lot of oxygen. So especially people who are living in cities, you need to do these certain pranayams every day.
Thank you so much, Shruti, for joining us in today's live session on cancer nutrition. And your insights were incredibly valuable, and I'm sure many people benefited from what you said. So, would you like to tell the audience how to reach you on social media and avail your services?
Absolutely. So you guys, whoever wants a consultation, please check out awaanahealth.com, www.awaanahealth.com. And my social media handle is Shruti underscore Sethi underscore. So whoever wants to get in touch with me, talk to me, please, I invite all of you to just, whoever is going through cancer, I would be glad to help them and talk it through, and any help or any service I'll be gladly offering.
Okay. Thank you so much, Shruti.